All right. Good morning. So, hopefully the title caught your attention. And I have no disclosures, and so let's get the boring stuff out of the way. The objectives are to identify your own personality type, identify the personality type of your coworkers, and then implement strategies to increase productivity while working with others as a team. It's a pretty big goal there. So, there's always a reason why I do something. Today is my 15th wedding anniversary. I didn't get there, thank you. I didn't get there without compromise, and I didn't get there without arguments and misunderstandings. So, here's my advice to you. You spend more waking hours with each other than you do with your spouses. Pretend that you're married to them whether you like them or not, and compromise and figure out their personalities and figure out how you can work together. That's the purpose of this. This has been in the works for 2, 3, 4 months. It's actually been spinning in my brain a little bit longer than that. I've actually done a series of Grand Rounds talks on the generation gaps at work and why a lot of us don't seem to get along. So this isn't anything new. It's ongoing. It's something that we deal with all the time. So don't think this is just about you. Okay. So, you know, there's going to be more e-cards and pictures in here than anything else. So the worst thing to do is misunderstand and then not come back together. So that's kind of what we're going to do. Y'all can groan. Yes, this is a Myers-Briggs workshop. I know you've probably anybody not know what Myers-Briggs is? So Myers-Briggs is one of the personality type indicators. It's most commonly used, and it's used to identify normal personality differences that may result in poor communication and conflict. And I actually found these actual quotes in different papers whenever I was doing lit search to figure out how this fits into the world of medicine. It actually fits more into the world of business. The business industry has been doing this for ages. But one of the other things that I found is that personality differences between doctors and patients may lead to miscommunication, and a lot of times that's why both of you get frustrated. You're just not understanding each other. And it happens also with coworkers. So I figured we've got coworkers in the room, not the patients, so let's start with each other, and then we can translate it down to our patients later. So there's 4 areas in the Myers-Briggs. The first one's energy style, the second one's cognitive, the third one is values, and then the fourth one is self-management. And all of them have an A or a B. They're not totally exclusive. They're actually on a continuum, and so you prefer one or the other. I prefer to use my right hand most of the time, but my left hand is there and it functions when I need it to. It's the same thing here. So just because you prefer one side versus the other, it doesn't mean that you can't adapt to the other when you need to. Make sense? Okay. So the first one that we're going to talk about is energy, and it's how you engage with the people around you, how you gain or expend and conserve your energy, and whether you process thoughts and ideas verbally or through quiet reflection. Okay? So the energy groups were groups 1 and 2. I will let group 2 go first. So what was your question? I'll read it. The question is, you have the weekend off and can go anywhere or do anything you want. What will you do? So that's the question, talking about energy. You're off. What are you going to do to recharge? What is relaxing and fun for you? What did you choose, ladies?
Well, I said I could take a long walk, I could go to the arboretum or visit a museum, these kind of things.
Okay, so Dr. Gungor wants to go on a long walk or go to the auditorium or go to a museum. And are you going to go with a bunch of people or just 1 or 2 people?
Usually I can combine all of them with my family. We are a small family and we enjoy those things.
So small family outings. Dr. B, what do you want to do?
Play with grandson, reading a book, watching TV, going to a concert.
Okay.
like visiting with friends.
Okay, lots of friends or one or two close friends? Okay, so which group is this? And I fit in this group too. I'm the one that wanted to stay in my PJs all weekend. Okay, so this is the introverted group, and there's nothing wrong with that. It's different from the extroverted group. What do y'all want to do, people?
Why do you call us that?
They want to travel, they want to shop. I mean, look at their list. It goes on and on and on and on and on. And how many people are involved in each of these activities?
It depends.
Several. They are going to clean and do laundry. That doesn't sound very good. That's a necessity, right? That's not a want to.
Yeah, that's a one.
Okay. So this is your extroverted group. So here's the difference between the two. The introverted group, you are energized from within. You need the quiet downtime to become energized. And when you're around a whole lot of people for a long time, this is what your battery does. Okay? I may act extroverted around this place, but this is what you do to me throughout the day. That's why about 2 o'clock I say I'm going to my office. And the door is closed and the light is off. Okay? And love to hang out, but I have to go sit at my house by myself. I'm in my pajamas by 5 o'clock every day. And I don't do a whole lot after that. My kids are like, Mom, can we go here? Can we go there? No, I've already changed clothes. I'm not going anywhere. And that's okay. So I also love cute t-shirts, so I decided that we probably need a few of these, but not too many, okay? So then you've got your extroverted group. They are energized by the outside world. Being alone in the quiet dark is draining to them. They need people and activity to be energized. They are the ones that after a long, hard day at work, they want to go to a party with 12,000 people so they can just talk to everybody. That's exhausting to me, but that's okay. So, what are the conflicts here? And the best way to do this is let's play the name-calling game. So, extroverts, what are you going to call introverts when they don't want to go to the party with you after work? Boring. Drag. Party pooper. They're not interested. They don't want to play with us. They don't want to help us. They'd rather just go sit in the corner by themselves. Introverts, what are you calling these people? Crazy. Crazy, noisy, loud, busybody. Okay, so those are some of the things that you get called, right? Yes, no. Sometimes they actually get called rude and egotistical. Actually, that's the introverts that get called that because they really don't talk a whole lot to anybody. I sit there and I talk to her and I tell her all this stuff and all she does is sit and nod. I mean, that's pretty rude, huh? You know, I've been called stuck up more than once because I'll just sit there and nod and okay. I don't have a whole lot to contribute. I finally got off of the resident interview trail because small talk with a stranger is painful. All right, so the introverts sometimes call the extroverts scatterbrained. You say the same thing twice, and then you change your mind mid-sentence the third time you're saying it. Well, you're not scatterbrained, you're just thinking out loud. Extroverts think out loud. That's why they talk the whole time they're in the team room. Whereas the introverts, being in that loud room, it's draining. You'd rather go sit back in the mole hole by yourself behind the closed door. So you need to understand that about each other. If you're an extrovert on a team with an introvert and they don't say a whole lot and they like to just go sit in the corner by themselves, it's not because they don't want to be a part of the team. It's not because they're not interested. They're just, it's draining. It's tiring. And the same thing, if you're an introvert and you're on a team with a whole bunch of extroverts and all they talk about is where they're going after work tonight because this has been a horrible day, It's not that they're party goers and they don't care. That's how they recharge. So you need to understand this about each other. And so these strategies to address conflict, this actually works no matter what the conflict and no matter why the conflict. So remember your energy differences, or you could say remember your personality differences, or remember your cultural differences. We've got a lot of different cultures in this room too. And once you remember those, then you can kind of use those. If one person likes to talk with people and you've got a conflict, have them go talk. You sit in the background and kind of do some of the brainstorming stuff in the background. Divide and conquer to where you both use your strengths, as opposed to butting heads because you're not getting along. So say what you want. My husband calls me out on this all the time. He's like, I can't read your mind. If you want something, you have to tell me. And then there's other times he's like, oh, so you're this big and you crawled in my head and you read my thoughts? Because I assumed one thing and that was not at all, and neither one of us talked, and so then it gets ugly. So it's the same thing. Say what you want. But what I would do is pull the person aside and go somewhere in private, because all this doesn't have to happen in front of a whole bunch of people. Pull them aside. Look, I need for you to do this. What do you need from me? And see if you can work it out that way. Manage the crisis together. Again, draw off of your strengths. If one person's really good at small talk and can talk anybody into anything, and you're having trouble with a patient or a co-resident, have them go talk to them, because they can convince them to do anything. And then you go do something else that's also helpful for the team. So you can manage it together. If that just doesn't happen, then you got to pull in the third party. That would be Dr. Cooper or Dr. Bocchini. I usually get thrown into this third party category frequently. Dr. Beal, Dr. Bass. Pull somebody else in. And a lot of times it's not that y'all are this far apart. You're really this far apart and you just see a fence between you, and we can help you get rid of that. Okay? And then the walk and talk, that actually helps a whole lot, because out in the middle of everywhere, the introverts are tired, they're drained. The extroverts are getting all this extra energy and they're all hyped up. So if the two of you go for a walk, the extrovert can talk the whole time you're walking. They can say what they want to say. The introvert will listen as they walk. They actually calm down because it's a calming thing to do. And they don't have to make eye contact with you and feel threatened in any way. And so you can actually talk about it without making eye contact, and you get the exercise, which you probably needed in the first place, and that helps with stress reduction too. Make sense? Questions? So that's your I's and your E's. So the next part is cognitive. How do you prefer to take in information? What do you want, the big picture, or do you want specific details? Do you see the data or the circumstances as they are or as they could be? Okay? So we've got group 3. What was your assignment?
Describe this object.
Okay? And so how did y'all describe it?
Spherical, asymmetric, shiny, red, firm, smooth, umbilicated, edible, indented, fruit.
Okay? So they described the apple, right? I really needed Anna over here.
Better with Anna.
I really needed Anna over here because y'all went the wrong way with this one. So basically they described the same thing. So if we actually had Anna over here, or there may be a few of the others, whenever I first did this workshop, I was in this group. And that's about as far as we went, and we were like, well, can we take a bite of it to see if it's sweet? Because if we can't take a bite of it, then we don't know it's sweet, so we can't use that word. Okay? But this group over here, they came up with Macintosh, computer, New York City, all kinds of stuff that I'm like, huh? It's an apple, it's a piece of fruit, people. So the difference between those two, you've got your sensors. They use their 5 senses to take in information and to use information. And when Dr. Gilbert did his learning styles, he had the S and the N in his. So this was actually kind of part of it when he did the learning styles for the residents. So you use all your senses to take in information. Whereas your intuitives, they've got the abstract information, they like concepts, not details, future potential and possibilities, connections and patterns, interpretation of the data, and how they experience the data themselves. So this slide drives every sensor crazy because it's not lined up like it's supposed to, it's not the same font as everything else, but the intuitives like it because, oh, look, it's pretty and you can do that. And they like the big concepts, okay? Do we have any intuitives in here?
Is that group 4?
Uh-huh.
Because I'm supposed to be over
You belong over here, right? Right, so what other words can you come up with to describe this apple?
Well, now that we're talking about it, I can't, but.
Okay. So, what are some of the conflicts here? What are some of the things that happen?
Details versus big pictures.
Right.
Details versus big pictures. Real and factual versus imaginative and what could be. Okay? So, in the medical field, there really are a lot more sensors than intuitives. And the few intuitives that are there drive the sensors crazy because we give them a list of labs and they're like, oh, and they get bored and they just want to go somewhere else and they start imagining all this other stuff and we're like, where'd you get that from? Okay? So, but it's okay. You can work together and actually complement each other. But the sensors are real and factual. They're concrete. They want to know what, they want to know how. And they trust their experience, and just give me the facts. That's it. That's all I want. Just give me the facts. Whereas your intuitives like the big picture, they like to be imaginative, they like to think what could possibly be, and they trust their inspiration, and they can just see it all. Okay? So, to get along, you need to know what the other person, what their preference is. And like I said, we do have some intuitives in our group, and let them brainstorm. Let them go there. They've got great ideas. But as the sensor, keep them on task. So let them brainstorm, but don't let them continue and go way out in the middle of nowhere. Kind of keep them on task. As the intuitive, let them kind of guide you, but don't let them constrain you too much. So you do have to understand the differences and work together. And if you're presenting a patient to someone that's the opposite preference, you may have to present them backwards. Start with the details and then lead up to the big picture versus start with the big picture and then move into the details. Does that make sense? Okay. So really not a whole lot of intuitives in this group. I was stretching when I threw a few all over there. I needed a few more in that group. So who else was supposed to be in that group?
Anna, Dr. McVie, Mr. Dr. Thomas, I think Terry Davis. Is that
Terry
right?
Davis,
Wilson,
Dr. Wilson, yeah.
and Sarah Adams.
Sarah Adams. So Sarah and Anna were the two that I really needed over here. They're your two artists.
And Dr. Beal.
And Dr. Beal. Okay? All right. Questions? So then the next one's talking about your values. And this is also part of the learning styles that Dr. Gilbert threw in, or that he was talking about. So it's your approach to decision making, conclusions based on experiences or the data that we've observed. How does the data match your personal value system? What's the logic and reason versus the empathy and identification? What's the objective rightness or fairness versus individual concerns and outcomes. So we think too much and we feel too little. So, group 5, what was your question?
Explain to a faculty or resident candidate why this is a good place to work.
And what did y'all say?
We have Epic. we have a wonderful hospital partner. We're a small program that works like a faculty, works like a family. We have a variety of pathology and enhanced learning experiences, resident autonomy, and a very supportive department.
Okay. And then group 6, why did y'all say that someone needs to work here?
Close-knit, excellent patient population, no fellows, lots of hands-on work, lots of patient resources. Shreveport has southern charm, cheap housing, relatively less traffic. Diverse population for the residents, family-oriented, good schools for children, and approachable attendings.
Okay. So, it wasn't separated as much as it was supposed to be. That's okay. So it's supposed to be your thinkers and your feelers. And one of the scenarios that gets used in the business world is you are the division head. You have 2 employees, and your boss comes to you and says you need to downsize because your department is spending too much money. Your 2 employees are a 28-year veteran who recently had a tragedy in his family and had to spend half of his retirement, and he's 2 years from retirement, but he makes $100,000 a year. Your second employee is a 2-year rookie who makes $48,000 a year, and his wife is pregnant, and their second car recently broke down. Who are you going to get rid of? So your thinkers are like, well, we got to save money, the old guy's got to go. But your feelers are going, but he's 2 years from retirement. How are he and his wife going to live whenever he spent all his retirement money? So that's kind of, thinkers do data, statistics, verifiable facts, personal information, objective truth, and fairness. Okay? Whereas your feelers have individual concerns. How are the people affected? Relational outcomes. What will it bring? Will it bring them together? Personal concerns and circumstances, personal value systems. So y'all did talk about how much it's going to cost to live here, and it's a small family, and people are approachable. So y'all did have more feeling things on your list than over here. And had I actually had y'all take the Myers-Briggs and separate you and not just go off the top of my head and have Dr. Cooper and Dr. Beal help me on this, maybe we would have separated a little better, but that's okay. But usually what happens with a scenario when you describe why it's good to work here, your thinkers talk about all the different systems of how things work around here. EMR, patient population, hospital partner. The feelers talk about everybody gets along, it's family oriented, everybody's really nice, and so there was more of that there. And thinkers versus feelers in the general population, about 80% of the feelers are women, which is why there's all girls back there. Well, Christian put himself there. I did. He just wanted to go sit with the girls. He's more of a teen, yeah. You're more of a teen. Okay, so what are some of the conflicts here? So this one guy says, well, I think it's clear that this is a logical thing to do in the circumstance. And this guy says, but how will the staff feel about that? So your thinker goes, why cloud the issue with emotional irrelevance? And then the other one goes, why is he ignoring people's feelings? Okay? So what are some of the things, if you want to name call again, this is the place to name call. Name call here. So thinkers, what do you want to call the feelers? Emotional. Hormonal. Unstable. Touchy-feely. Bunch of irrelevant information. Feelers, what do you want to call the thinkers?
Cold-hearted.
Cold-hearted. The B word comes out a whole lot. What else? Hard-nosed.
He said machines.
Hmm?
Machines.
Machines. just trudge through, no feeling involved whatsoever, unfeeling, uncaring. Okay, so those are some of the things that come out in this. So I decided to throw in supervision strategies here because attendings supervise residents, residents supervise interns, interns supervise med students, and the med students conveniently are not here today. So when you're supervising a thinker, they want the constructive criticism. They want logical explanations, they want you to be truthful, and they want to be able to sit there and analyze the issue with you. But if you are actually supervising a feeler and you give them constructive criticism, they're going to cry. They're going to be upset because you don't appreciate them and you're not concerned for how they feel. So you need to appreciate what they're doing. You need to give them the positive strokes. They want to have a personal discussion of the issues, not just a logical explanation. This is where you do need to be tactful, and for thinkers that's hard sometimes because this is what it is. And they want to help people. So when you are actually supervising a thinker or a feeler, you need to keep these things in mind. It'll make things a whole lot easier. And this kind of comes in, my husband's a feeler. And, you know, in the 15 years, we've done counseling a few times, and it just absolutely drives me insane that I am told I'm supposed to tell him thank you and I appreciate him for taking out the trash and putting his dirty clothes in the laundry basket where they belong. I mean, is he two? Why should I thank him and appreciate him for doing the right thing? I don't understand. But as a feeler, he needs that. He needs to feel appreciated and he needs to know I'm concerned. Okay? It's funny. You're either on one side of this or the other, most people. Some people can swing both ways, but most people are one side or the other, and it's like, but I don't understand. Why do I have to tell him thank you for doing what he's supposed to? He's not two. But you do have to make them feel appreciated and concerned. And again, remember you're married to your coworkers. You spend more awake hours with them than you do with your spouse. You could learn something from marriage counseling. All right, so the last category is self-management. So it's our manner of structuring and scheduling time and work, structure and plans versus spontaneity and flow, work patterns, whether they're measured and paced versus sporadic bursts, and do you halt the flow of information to make a decision, or do you continue receiving information while prolonging a definitive answer or action? So that's groups 7 and 8. So, I'm going to let group 7 go first because it's going to drive group 8 crazy. What was your question?
The question was, I'm giving you $1,000 to redo the ward team room. How will you decide what to do?
Okay,
So we involve all the residents, who are the people who most of the time spend the time in the room. So it involves residents and it involves faculty. It involves the students, the lesser part, but it's more of the, most of the time it's the residents.
Stick with the board.
Yeah, so what we do, I mean, we,
back there.
survey, we fund company, we plan and run ideas,
He's gotta give them
through hospitalizations, call Dr. Bikini. That's what we did in the board.
All right, yeah, this $1,000 is ultimately coming from him because it's out of my stipend. Okay, so what did the other group say?
We were very straightforward, very quick to it. You survey people, figure out what people want, requests from others, ask people what they want, prioritize the problems, what's reasonable in the budget, want versus need. You make a list of what you want to do, and you have a small group who organizes it.
Okay. I'm surprised y'all didn't say, this is what the residents need, this is what we're doing.
No, we're doing that.
the small group
That's
that
the small group
decides
that
what-
decides. Like, people give their options, and then a small group actually decides.
So the small group says what they want, but the small group ultimately decides.
Yes.
Okay, so I don't know if y'all noticed, all of group 8 was here on time. And they were the first ones writing on their list. Group 7 had 1 or 2 stragglers, and it wasn't until I said, okay, that's enough, we need to start now, that they actually wrote something on the piece of paper. Okay? And they want to poll people and form a committee, and so they are the ones, they are called perceivers. They want to take things as they come, they want to wait before making decisions, they want to keep time and schedules open-ended, they embrace spontaneity. It's this guy who goes, there's a schedule for every day of our vacation. That was kind of like my husband when we went to Disney World. I had a vacation planner, and she told me every minute of every day where we needed to be, and I was fine with that. I didn't want to have to think about it. I just wanted to have to go where the paper said to go. Then you've got what's called...
Immediately ask for more money. After thinking, he said, no, we'll invest it now and decide later when we have more money to avoid all conflict today. There you go.
Okay. So, your J's back here, they plan projects in advance, they structure work time evenly to meet the deadline, they set a plan and stick to it, they make a decision as soon as possible to bring closure to the question or issue. So I guarantee when they send out this survey, there's a 24-hour time deadline. And if you don't respond, oh well. There's a 24-month deadline on your poll so that you can invest the money and make a little bit more. And your J's schedule time carefully and make the most of it. So this is made a schedule for every day of our vacation, and that takes the stress off because I don't have to worry about where we're going and what we're doing. It's right here on this piece of paper. Okay? So, what are the conflicts?
Our office is fine.
So what happens?
One of us goes in and organizes it.
You put it when he's not looking, and then you won't be able to find anything.
In a hazmat suit.
No, seriously, when you've got someone who likes to just kind of go with the flow, see how things happen, they want more information, but then you've got somebody else that says, this is what I want to do, this is how I want to do it, and I want to do it now. My husband's a P. When I tell him something needs to be done and I don't actually put the word now on the end of it and he says, okay, I have learned the next question is when? And I try to pin him down, okay? I've also told he and my son, when I tell you to do something, the word now is always on the back end of it, whether I say it or not. It needs to happen now. Okay, so, what happens? The J's want to do everything now. The P's want to get more information, make sure this is the right thing to do, and it'll get done. So there's frustration there, but that's okay. Sometimes you do need a little bit more information, but sometimes it does need to get done now. So the other thing is perceivers help being overly rigid and compulsive, and they have creative solutions. So they can help you. They will think of things that the judges just didn't think of. And the judges help complete projects in a realistic time frame. Okay? So, kind of what needs to happen here is, if you're working with a perceiver, they want you to give them a task and let them do it. But you got to give them a deadline. If you have a judging person, they don't want a task. They want step by step, how do you want me to get this task done, and when does it need to be done? And you really don't need to tell them when to do it because it'll be done now. Okay? So you got to know who you're working with. If you're working with a perceiver, you've got to give them deadlines. If you're working with a judger and you want things done in a certain way, then you need to tell them the certain way you want it done. So you have to know who you're working with to be able to get this all together. Make sense? Okay. So, first objective was to identify your own personality type. So think in your head, what are your preferences? Where are my eyes? Look around the room, people. Where are my eyes? Okay? Where are the E's? Okay? Do I have any N's? All right. The rest of us are sensors. For the most part, remember, it's a continuum. Which one do you prefer? You may be able, hello. You may be able to do a little bit of both. There it is. But it is a continuum. Thinkers? Feelers? Little bit of both.
It's situational.
It's situational, exactly. Where's my P's? Okay, and then the J's. The J's are all of my multicolored pen list makers. All right, second objective, identify the personality type of your coworkers. So, what are my preferences? Think about it. Kind of told you already. So where do I fit?
Left side, all the way down.
ISTJ, all the way. And when I first did this years ago, I was actually at a meeting where they did a Myers-Briggs workshop, and they had us take the inventory, they had us do all the questions, and then they sat us in a circle from T to F based on score. I was in the first, second, or third chair of every one of these. I've learned to be a little more extroverted. I've learned to be a little more intuitive. The feeling is coming. I don't know that the perceiver will ever get there. You've seen my office, okay? And you see how I like to keep the board in the team room all lined up, all nice and neat, and there's a to-do list on the side. Okay, so everybody pick a partner. We've already kind of raised hands, but everybody pick somebody. And guess what they are? Kind of already know. So let me ask you this. You got it? Yeah? No?
The S and the N. I go back.
Okay. Everybody know what their neighbor is? Do you now understand some of their habits? All right, let's wrap this up. So, you kind of know where everybody fits now, right? Yeah? No? You understand some of their habits now? You understand why some of their habits drive you crazy? Hopefully you've gotten a few strategies to kind of meet in the middle. Because the last objective is to actually implement strategies so that y'all will actually work together as a team productively. Okay? So when you're in clinic and there's a line of charts and the J's are seeing chart after chart after chart and they're seeing front chart, front chart, front chart, front chart, and the P's are going, this one looks interesting. You might need to put a few boundaries on that. Come together. Look, in every hour, You can pick one that you want, but everybody else you have to pick from the front. Meet in the middle. Or every half day, you can pick one. You can go through and hand pick one each half day, but everybody else you got to see front to back. Meet in the middle somewhere. Okay? Ward team room's the same thing. It's okay to let somebody go sit back in the resident library to do their charts because they just can't stand all the noise in the team room. It doesn't mean that they're hiding. It doesn't mean that they're running away. Now, granted, they're not going to answer the phone all day long. And so you may have to say, look, I'll sit and answer the phone for a little while so you can go chart in the back, but in an hour, can you come answer the phone and come work in here again? It's okay. Figure out how to work together. You have a very needy family that likes to talk. Send the extrovert to go talk to them. That's fine. They're great at small talk, and they can convince anybody to do anything. Let the introvert stay back and sit and work on the computer in the quiet room. That's all I got. So some of you second years, just throwing a bug out there, you have to do a grand rounds next year. I like doing series of grand rounds where it's kind of the same thing but in a series, and it's probably been 7-8 years since we've done the generation gap. It's time to do that one again. So think about it. Maybe we can get together. If somebody's interested in doing that, you can present your generation, I'll present my generation. We'll find somebody to present the generation up. And then there may be one or two of you in here young enough to present the generation down, because there's currently 4 generations in the workplace, and that's causing problems. So not only personalities, but generation gaps are causing problems too. And Dr. Pug, it's probably been 7 or 8 years since we've done that. It's been a while. Charlotte was still here. Yeah, she did the baby boomer. So think about it. We can do that. The other thing that plays into this is cultural differences. So if a few of the second years want to get together and present some of the cultural differences, because just in the second year class, there's multiple cultures. And so that may be a great way to make your grand rounds presentations actually a group project, is if y'all did cultural differences. So think about it. There's a bunch of different reasons why people don't get along around here. For the most part, peds are the happy people and we get along with everybody. But just kind of remember some of this. Questions? Did I get most people in the right groups? Except for this one? Huh?
Strikingly accurate.
So most the I's and the E's were fairly easy. The S's were easy. The N's were hard. The T's and the F's were a little bit easier. And then the P's and the J's were probably the easiest.
Just help me, I just need to know where Sajal is. She's on Mondays and...
You need to know where Sajal is. She is an ENFJ.
Okay.
Yes?
Yeah, ENFJ. That is what I am. I just said that. I don't know why.
She is an ENFJ. So it's the J part of her that drives you crazy.
I'm just not sure you got Dr. Bienvenu, Mr. Dr. Bienvenu correctly.
I was Monday Continuity Clinic. He's exactly where he needs to be.
He always has a story.
Ask my wife to tell you about what happened when we took our last family vacation to Hawaii. How did we decide what we were going to do, how we were going to spend our time?
I planned it out.
We planned it out, and every day he goes, okay.